Sound.
Good day, everyone, and welcome. My name is Rudy Page, and this is one of our first dialogues under the Prostate Health We Care Call to Action Roadshow. And this is presented by the community health researchers who recently launched the Prostate Health We Care Call to Action Roadshow. And this will be running from the 1st of February to the 30th of March within the areas of Bruce Grove, Lordship Lane, Mulberry Junction, Northumberland Park, Selby Road, Seven Sisters Road, Tottenham High Road, Turnpike Lane, West Green Road, White Hart Lane, Wood Green High Road, and nearby areas, all within the London Borough of Haringey. The Community Health Researchers is a partnership of organisations supported by North London Central Integrated Care System. The partnership is led by Bridge Renewal Trust, which includes Sewn Together, Rise Project, Black Arts Production, and Haringey Basketball CIC. This initiative is facilitated by MCW Connectivity. It's a great chance also to get health checks, nutrition, mental well-being, employability, and housing information, and also to get involved in the Quality of Life Expectations Survey. The community health researchers will hold both online and face-to-face dialogues to share the knowledge gained from individuals and families who have had first-hand experience with the support of clinicians and advocates who have the appropriate cultural awareness and understanding. These dialogues will take place in familiar settings such as businesses, community centres, places of worship, and will be covered across a number of radio stations serving the community. The Prostate Health We Care Call to Action Roadshow by the Community Research Champions aims to educate about healthy living and lifestyle activities and raise awareness of improving prostate health pathways and services. So I'm really pleased today that our first dialogue is with Vasco Stevenson, and he's very well known in the Haringey area. He's spoken at many of the community health and well-being events. And this dialogue that we're going to have today will focus on 7 key areas of importance as it relates to prostate health. So that will be on self-care, diet, mental health, nutrition, exercise, hydration, and sleep. And knowing Vasco, we're going to get a lot more as well. So, Vasco, very good to see you.
Likewise, Rudy. Unfortunately, I don't have to get up at 8 o'clock in the morning to join one of your events.
That's a relief.
Thank you so much. It's good to be here.
I'd like to now hand over to you, Vasco. Thank you.
Thank you so much. Grand Risings, brothers and sisters. This evening, the theme for this presentation is about prostate health, not prostate cancer, prostate health. In other words, how to reduce your risk of getting prostate cancer as you age, as you go through life, okay? And on the screen, you can see who I am. And If you want to contact me for any reasons, my number is at the bottom. And I am on 2 radio stations, oneharmonyradio.com on Sunday mornings at 10, and that's repeated on Wednesdays at 11. And then on Tuesday nights, I'm on lwrradio.com. And when you get there, you find the platform LWR Talk. That's at 9 p.m. on every Tuesday night, okay? How I'm going to approach this is I'm going to make a short introduction, and then I'm going to get into the program. The introduction is really to give you some idea of aspects of the prostate so that you have a better understanding when I launch into the meat of the program, so to speak. And the theme is prostate health and well-being. So very quickly, the prostate gland is usually out of sight and usually out of mind. And 70% of adults don't know what the prostate gland does. Notice I didn't say 70% of men. 70% of adults, that include females, don't know what the prostate gland does, okay? So what does it do? It is part of the male reproductive system, and it makes one of the fluids in semen, because semen is made up of many different types of fluid, okay? And it makes one of those fluids. Risk factors: African Caribbean men are 3 times more likely to develop prostate cancer than European men. And nobody so far has been able to give a definitive reason as to why that is. So we just have to wait until some scientist comes up with a definitive answer or reason. There are 3 things that can affect the prostate. The first one is called prostatitis, which is really inflammation or infection of the prostate. And let me throw this in now. Any medical word you see ending in itis simply means inflammation, okay? BPH, benign prostatic hyperplasia, is usually a non-cancerous enlargement of the prostate, and most men will suffer from this at some stage. And then, of course, we have prostate cancer, which could be slow growing or aggressive. And evidence shows that in Black men, it has a tendency to become aggressive. And here is a representation of the prostate gland. This one showing the urethra through which the urine flows from the bladder through the prostate gland. Okay, these 2 bits here on the side are the prostate gland. This is the urethra. And this shows an enlarged prostate, choking off the urethra so that your urine flow becomes much slower and not as powerful as perhaps when you were younger. I show you this from a different perspective. This golden ball here is the prostate. This is your bladder. This bit here is the urethra, and of course you void through your penis, okay? Unfortunately, nature has made man in such a way that the only way you can get to the prostate gland without surgery is by way of the back passage here. So when you're being examined, there are 2 tests. One is the PSA, prostate antigen test, and the other one is the digital rectal examination, commonly referred to as a DRE. And that is where you get some men being homophobic and they will settle for the prostate-specific antigen blood test, but don't want to do the DRE. So what to look out for? Prostate cancer may cause similar symptoms to non-cancerous prostate problems. So because you may be suffering from any of these here below, like a weak or reduced urine flow, getting up often at night to urinate, dribbling, urgency when you want to go, you have to go, there's no holding back the urine, difficulty starting, sometimes you go and you stand up in front above the bowl and nothing happens, and of course, the dreaded erectile dysfunction. So if you're suffering from any of these, it does not necessarily mean that you have prostate cancer, okay? It could be just the benign swelling of the prostate, hyperplasia. And here are the two tests I was referring to, the PSA, prostate-specific antigen blood test, and the digital rectal examination, which checks for hardness in the prostate. And I always put a little joke in, yes, to keep you entertained. And the DRA is not really this bad. Now, I wouldn't want to have a digital rectal examination with someone who has fingers this size. Okay, that's just a bit of humor. Okay. So what to look for? These are less common symptoms. Pain in the lower back, hips, or pelvis. Blood in your urine or semen. But some men with prostate cancer may have no symptoms whatsoever. So that's about 10% of men with prostate cancer who do not have any symptoms. But if you're getting pain in your lower back, hips, or pelvis, that could be a sign that you have aggressive prostate cancer that has metastasized, left the prostate gland, and gone into your bones around your back, your hips, or your pelvis. And that is particularly dangerous. Okay, so let's get into the meat of the presentation, having set the scene. I don't know if you've ever come across this word andropause. We all know that females go through a change of life called the menopause, but it is a fact that men also go through a change of life, which is known as the andropause. But a lot of doctors don't use the word andropause. They simply say low testosterone. Testosterone, of course, being the primary male hormone when it comes to sexual matters, okay? And it does exist. So let me just amplify it a little bit for you. By the time a young man reaches the age of 30, his testosterone level starts to drop off 10% for every 10 years. And so by the time he reaches 40 or 50, his testosterone level is much lower than when he was in his 20s. It is a very subtle change, and that's why some doctors refer to it as low testosterone rather than andropause. Andropause, of course, being the correct terminology, and it does exist. So let's go through these very quickly. Andropause is a condition that is associated with the decrease in the male hormone testosterone. It is unlike the menopause in that the decrease in testosterone and the development of symptoms is more gradual than what occurs in women. So as I said, it's more subtle. Men who experience symptoms associated with andropause have lower amounts of bioavailable testosterone in their blood. Therefore, tissues in the body that are stimulated by testosterone receive a lower amount of it, which may cause various physical and possibly mental changes in the person, such as mood swings and fatigue. So some men experience psychological and physical changes, and of course, women do more seriously so than men, okay? Testosterone is responsible for deep voices, muscle mass, and facial and body hair patterns found in males. And if you see women with, or hear women with their voices drop and hair around their face, it is possible that that could be just an imbalance between the male hormone testosterone and the female hormone estrogen. As men get older, the level of testosterone in the body and the production of sperm gradually becomes lower, and they experience physical and psychological symptoms as a result of these low levels. This is part of the natural aging process, and it is estimated that testosterone decreases about 10% every decade after men reach the age of 30, which I mentioned earlier. Although symptoms may vary from person to person, common symptoms of men going through andropause include low sex drive, difficulty getting erections or erections that are not as strong as usual, lack of energy, depression due to these hormonal changes, irritability and mood swings, loss of strength or muscle mass, increased body fat, and hot flashes. And you would not believe that some men actually experience this when they're going through this very subtle change between the two hormones, testosterone and estrogen. So now you know that if you're experiencing this, you can understand why it's happening. Based on the studies and the latest research, it does not appear that testosterone causes prostate cancer. Bear this in mind, it's very important. It does not appear that testosterone causes prostate cancer, nor that it has a negative impact on men who already have the disease. At the same time, another hormone, estrogen, the female hormone, seems to play the main role in the disease. Bear that in mind. Signs of and symptoms of elevated estrogen in men: low libido, breast development, what we usually call man boobs, risk of stroke or heart attack because testosterone plays a role in the health of the heart. And when the level is low, there's a possibility that you could have a risk, you could have a stroke or heart attack. Infertility means you may not be able to have children. You put on weight, and these are basically the same as those associated with low testosterone. So estrogen, not testosterone, is a hormone that needs to be equally managed as part of living a healthy and cancer-free life. And this is what we want you to do. Live a healthy and cancer-free life, prostate cancer specifically. And here are some foods and actions that will help you boost your testosterone. Intermittent fasting. It will help you reduce weight. It will help you keep diabetes at bay, for instance, and it will boost your testosterone. Eating healthy fats. Healthy fats, I'm not talking about the fats that come from animal products. I'm talking primarily about avocado, coconut oil, and flaxseed, omega-3 fatty acids. Okay, those are the three best things to eat. Have a liver cleanse, and there are herbs and spices that you can take that will clean your liver out in less than 2 weeks. Reduce stress. Get vitamin D3. And if perchance you're not in the sun, you're in a temperate climate, such as those of us here in the UK, if you're going to buy D3, vitamin D3, make sure you're taking a spray or drops that you can put under your tongue. Do not go for the tablets, okay? Spray or drop under your tongue. That's the quickest way to get it into your body. Get rid of sugar from your diet. Sugar is very acidic. It creates a very acidic environment in your body. And when we talk about sugar, we're not talking about the 2 lumps that you put in your cup of tea. There are lots of hidden sugars that people eat. And as you know, sugar is very low on the pH ratio, but very high on the glycemic index, right? And as a word of information, any, should I say, natural word relating to health that ends in OSE is a sugar. Okay, fructose, lactose, sucrose, dextrose, they're all sugars. And if you're going to drink any sweet drink from a carton, look for 3 words on it. If it says high fructose corn syrup, or HFCS as an abbreviation, if it says aspartame or aspartame, or if it says concentrate, do not drink that, because that drink is full of sugar, okay? Get quality sleep. Sleep is very, very important because there's a saying that when you sleep, your body repairs itself, but it goes a lot deeper than that, which I am not going to go into in this presentation. Lower your body fat. You can do that by intermittent fasting, by exercising, and there are other means as well. And engage, if you can, in weight training. All of these will help boost your testosterone. To rebalance our hormones and reclaim our manhood, we've got to start doing these 5 things. Start getting the extra estrogen out of your body. Start making more testosterone naturally. Stop the conversion of unused testosterone into estrogen. Stop ingesting fake estrogen in food, water, and air. Okay, there are fake estrogens out there, some in the food you eat and other places, okay? Start melting estrogen producing belly fat. So when you're overweight and you have belly fat, your body will produce more estrogen. So let's look at some of the things you can do to reduce estrogen. Put a whole lemon in your juicer and blend it with a few green leaves and drink the concoction. Or you can freeze a whole lemon, then put some gloves on, grate it, put some hot water with it and drink it. Why? Because the skin of the lemon contains a compound called dilimonene, okay, which boosts your testosterone and reduces your estrogen. As simple as that. A study of the impact of a plant-based diet on prostate cancer. In this latest report, which was conducted by researchers at the University of South Carolina's Arnold School of Public Health, the consensus was that the flavonoids, that is substances in plant that have an antioxidant and other health benefits, flavonoids, which you find in fruits and vegetables and herbs and teas, may provide men with a 25% lower risk of developing aggressive prostate cancer. Okay, notice it says aggressive, and that is what applies to Africans. And we're all African here, I believe. Okay, so herbs, teas, and vegetables, and I'll show you that as we go forward. Here's an interesting one, coconut oil for cancer prevention and treatment. So part of this presentation, my remit is to show you herbs and foods and other things that will help, as I said, reduce your risk of getting cancer. So here we go. The first one up is coconut oil. It has 2 qualities that help it fight cancer, including the ketones produced in the oil. Tumor cells are not able to access the energy in ketones and are glucose dependent. All cancer cells are glucose dependent. But we're talking here about ketones, okay? There's lauric acid in coconut oil, which is converted by your liver into something called monolaurin, which is further converted into ketones. Incidentally, coconut oil has been proven to be also able to reduce your risk of Alzheimer's disease. Plus, research showed that lauric acid found in coconut oil may have anti-cancer actions by triggering anti-proliferation and pro-apoptotic effects. Let me explain this. Triggering anti-proliferations, that means the cancer doesn't spread, okay? It is confined to the prostate. And if the cancer is confined to your prostate, then it doesn't affect you. As long as it stays in the prostate, it's not going to threaten your life. It is when prostate cancer leaves the prostate and goes into the bones and around your hip and pelvis, which we saw earlier. And pro-apoptotic means that the cancer cells kill themselves, a process known as apoptosis. Okay? So this is what the lauric acid in coconut oil will help provide to your body. So make coconut oil your main oil that you use in your cooking. This type of infectious prostatitis, there are two. Remember we saw prostatitis earlier, then benign prostatic hyperplasia, then prostate cancer, okay? There are two types of prostatitis. One is chronic, which is low-key and ongoing. Anything that is chronic, you get a little niggle here, you don't pay it much attention. Next week, you get the niggle again. A month from then, you get the same niggle. That is low-key inflammation. The other one is acute, which is a sharp pain that will cause you to go and get medical attention, okay? And that can be treated by what they call medication, all right? Urine tests and drainage of a prostate abscess show that candida overgrowth in the prostate. Now, what is happening these days is that a lot of scientists and doctors are saying that it is in part candida that causes benign prostatic hyperplasia. In other words, a swelling of the prostate. That is coming into fore more and more. And what is candida? It's just a type of yeast, isn't it? Okay. Patients with recurrent urinary tract infections should also be tested to evaluate the possibility of fungal prostatitis. Doctors often recommend treatment using antifungal agents, but it is usually a prolonged treatment. All the more reason why you should then go back to coconut oil, which is antifungal, anti-inflammatory, anti-everything that's dangerous to your body. Allium vegetables. This group includes garlic, onions, leeks, and chives. And they have been shown to help kill prostate cancer cells. Okay? Onions especially, they contain a compound called quercetin, which is very beneficial to the prostate gland. And I, if I may say this, I can speak from personal experience on this. Onions, okay? So what you can do, especially the red ones, by the way, especially the red onions, what you can do, you can chop the onions up, squeeze all the juice out of them, drink that juice with probably a little bit of honey because it's not going to be the most pleasant thing. And then you can actually cook the rest of the onions and eat them, okay? Tomatoes contain a compound called lycopene, which is very beneficial to the prostate, and it slows prostate cancer growth and it stops the cancer from spreading. A tip about tomatoes. Firstly, the redder they are, the more lycopene they have. So if you're going to buy tomatoes, buy them as red as you can possibly get them. The worst way to eat tomatoes is raw. So you want to cook these very slightly, okay? And in doing so, you want to put some black pepper on them because the compound in the black pepper, which is piperine, works with the compound in the tomatoes, which is lycopene. And it makes it what they call more bioavailable in that your body would absorb more of it. Okay? Moving forward. It was found that men in the category of highest intake of allium vegetables are onions, garlic, shallots, leeks, anything in that family, spring onions, all of that family, had a statistically significant lower risk of contracting prostate cancer. than did those in any other category, okay? So allium, especially from the red onions or garlic, add these two to your diet on a regular basis, and you will significantly reduce your risk of contracting prostate cancer. We get back to candida. Invasive candidiasis in the prostate is the most common type of fungal prostatitis. This type of infection can be similar to acute prostatitis and chronic prostatitis caused by bacteria. So you can have a type of prostatitis that's caused by bacteria, and you can have one that is caused by fungus. However, it usually falls in the category of a prostatitis syndrome known as chronic prostatitis. As I said, anything that is low key or low grade and is ongoing all the time. That is what is known as chronic. Candida and yeast infections. A study published in the journal Antimicrobial Agents and Chemotherapy found the capric acid and lauric acid in coconut oil made for an effective natural treatment for Candida albicans and yeast infections. Again, we have a study from this organization saying, okay, if you're suffering from Candida or yeast infections, then go to coconut oil, and these two particular capric acid and lauric acid will help sort that issue out. To effectively kill Candida and yeast infections, remove processed sugar and refined grains from your diet and consume plenty of healthy fats. I already told you the three main healthy fats: flaxseed, avocado, and avocado oil and coconut oil. So you take 1 tablespoon of coconut oil 3 times daily as a supplement, okay? You will also lose weight because coconut oil is a very, very good slimming oil. It burns fat very well. Now, this is an interesting one, tantric sex, semen retention. And you may be asking yourself, well, what has this got to do with my prostate gland? I will explain that to you. The goal of tantric sex is to achieve spiritual or energetic contact during a sensual experience. This practice is slow, and the aim is not always to achieve an orgasm. The practice intertwines spirituality, sexuality, and a state of mindfulness. Okay? So it's a very spiritual thing, tantric sex. The benefits of semen retention. It reduces erectile dysfunction when you practice it. It decreases anxiety, increases your self-esteem. It gives you more sexual energy, a general increase in energy levels, more restful sleep, deeper personal relationships, and increased ejaculation. Why am I telling you all of this? In tantric sex, the idea is that if you're going to be intimate with your partner, you should only send your sperm into the world on 2 occasions out of that 10. And on the other 8 occasions, you practice semen retention. You retain your semen, okay? Let me proceed, and at the end of this, we'll see the reasons why. Most of the fluid in semen is made up of secretions from male reproductive organs. So here we go. Semen contains citric acid. Did we see that earlier? Citric acid. Free amino acids, fructose, enzymes, a long word here called phosphoryl chloride, prostaglandin, and then these 3, potassium, which is exceptionally good for lowering your blood pressure. If you're deficient in potassium, your blood pressure is going to go up. Remember that balances with sodium. Yes, these two electrolytes balance each other out, and the quickest way to reduce your blood pressure is to increase your potassium. Then we have the B vitamins and we have zinc. So let me just elaborate on this for you. 80% of the zinc in your body is in your prostate gland, and zinc is necessary to keep your prostate gland healthy. So if you're having intimate relationships with your wife or your partner, and every time you're doing that, you're sending your sperm into the world, what you're doing is depriving your body of zinc, B vitamins, potassium. Okay? And these are what are needed to keep your prostate in good health. That's why tantric sex says you should practice semen retention. I hope you're following that, okay? Right. Immune system boost, antibacterial, antifungal, antiviral, so it kills viruses. Coconut oil's lauric acid, monolaurin, they say here, which has been shown to reduce candida, fight bacteria, and create a hostile environment for viruses, okay? Many diseases today are caused by the overgrowth of bad bacteria, fungi, viruses, and parasites in the body. And coconut oil is especially useful in ridding the body of viruses, bad bacteria, overgrown, fungus and all of that, and parasites. So if you make coconut oil your main oil in cooking, then your health is going to improve tremendously, and your prostate health will also improve. Studies have found that coconut oil may be an excellent fat to eat during menopause. They're even recommending it for women, and also may have positive effects on estrogen level. So in other words, it will bring about a balance between testosterone and estrogen. In order to naturally balance hormones, reduce sugar and grain consumption, and load up on healthy fats from coconut, avocado, flaxseed, and ghee. You can also consume other coconut forms such as coconut butter or coconut water, which is a very powerful, full of powerful electrolytes. Coconut oil for hormone balance. The health benefits of coconut oil include hormone balance as well. So it will help balance your testosterone and estrogen level, and your beer gut will go down, okay? Because your beer gut is as a result of mainly of the imbalance of the testosterone and the estrogen. Coconut oil may also help naturally balance hormones because it's a great source of saturated fat, including lauric acid. So we've seen a couple of things that you should be adding to your diet regularly. Coconut oil, tomatoes, okay? Here's some important advice. You are 2.5 times more likely to develop prostate cancer if your father or brother has had it. So check with your brother, check with your uncles, check with your dad, and see if he has had prostate cancer. And then, according to what they say, you can guesstimate your risk of getting prostate cancer. And for your diet, cut out dairy products as much as you can. And eat more green vegetables, broccoli, kale, spinach, cauliflower, anything that's green, okay? Take more prostate-friendly vitamins, and I'm going to show you that a little bit further down. So here are the worst foods for prostate health: red meat and processed meat, white potatoes, because white potatoes are very high on the glycemic index. And the glycemic index is a marker for diabetes, okay? Calcium and dairy products. Now, one thing that we're advised not to do is to take calcium supplements. You should be getting all of your calcium from your food, spinach, cauliflower, kale, those types of things. Sugar, of course, we touched on sugar earlier. Reduce your intake of sugar completely. Even when you're eating cookies and all of that, bread, that's sugar, okay? Canned tomato products. Anything that is canned is usually full of salt, and salt equates to sodium. So be very careful of canned tomato products. French fries or chips. We saw white potatoes here, high on the glycemic index, which is a marker for diabetes. But why French fries? Because the oil they're frying these chips in are not the best oils. You get something like canola, vegetable oil, sunflower oil, safflower oil, all of those things full of omega-6 rather than omega-3, okay? And then if you go to a proper fish and chip shop, they don't change their oils every night, do they? Perhaps it's the same oil they used last week or something like that, okay? Farmed salmon, full of chemicals because they feed them chemicals. In fact, the situation is so bad that the seabed under where they have the farm salmons, everything is dead, seaweed, everything, because when the salmon poop, that hits the seabed, the chemicals there then destroy whatever seaweed or whatever was growing there. And of course, artificial sweeteners. You want to keep away from things like that. So these are the worst foods for your prostate health. What can you do about it? Drinking milk regularly, that's cow's milk, doubles the risk of prostate problems. Doesn't matter whether it's pasteurized or whether you're drinking it raw. Why is that? Cows are milked soon after giving birth to a calf. And that is the time when the estrogen, the female hormone in that milk, is at its highest. And that's what you're going to drink when you're drinking cow's milk, okay? Eating meat every day triples your risk. Meat, of course, is very low on the pH ratio. It makes your body acidic rather than alkaline. So does milk. Not eating vegetables quadruples the risk. So when you eat your vegetables, okay, you reduce your risk. And of course, exercise. Now, this word cuts two ways. You can either go in the gym, or you can go running, or you can put an S in front of the word exercise and engage in that activity occasionally, 2 out of 10 times, okay? So what can you do about it? Here's what you should be eating on a regular basis. Avocados, remember, vitamin E, and of course, omega-3. Coconut products, sweet potatoes, probably one of the best foods in the world. Blueberries, tomatoes we touched on, broccoli, garlic, turmeric, to my mind, the best herb in the world. Again, if you're going to use turmeric, you have to use a bit of black pepper so that the piperine, the compound in the black pepper, works with curcumin, the compound in the turmeric. But you can also add another couple of spices that will make the curcumin more bioavailable, okay? Fenugreek is one of them. And you can also use a bit of ginger, basil, oregano, those types of spices to improve your absorption of curcumin. Cayenne pepper, exceptionally good for the prostate and exceptionally good for thinning your blood so that it flows freely and reduces your risk of heart problems. Cinnamon, also a blood thinner, also very good for the prostate. allspice. I'll come back to that in a few minutes. Cloves, holy basil, red kidney beans, black eyed peas, wild salmon as opposed to farm salmon, sardines, green tea has very powerful anti-cancer properties, spinach, and we touched on onions early. So these are what you should be eating on a regular basis. And of course, drinking adequate amounts of good clean water. Supplements that may help. Vitamin A. Where do you get vitamin A from? Carrots and sweet potatoes, especially the orange colored ones, okay? Vitamin D3, I spoke about that a few minutes ago. Spray or drops under your tongue. Vitamin E, sunflower seeds or avocados. Again, very good for your body. So look at this, A, C, E. And vitamin C, of course, from oranges especially, grapefruit, pineapple, kiwi fruit, they're all full of vitamin C, okay? Zinc, most important mineral for your prostate gland. You should take at least between 25 and 50 milligrams of zinc per day. All right? Zinc, if you're a young man and you're thinking of getting children as well, becoming a dad, if you don't have adequate amounts of zinc in your body, your sperm are going to be weak. And if you do have a child, that child will have a weak immune system, right? So zinc is particularly important. Selenium, which you can get from green leaf coriander, or you can eat 2 Brazil nuts per day. Not more than 2 because you can overdose on selenium. Magnesium, and most people are deficient in magnesium. Lentils and lots of different spices contain magnesium. Magnesium is something that relaxes your body, okay? And one of the reasons why men find it difficult sometimes when they're being intimate is that they get too anxious, yes? And that's where magnesium comes in. It relaxes you, so you can perform better. And of course, beta-sitosterol, which is another compound found in avocados. And here's something that a lot of people don't talk about, but when Rudy and I were at the event last week, we did mention this, Kegels, or pelvic floor exercises. You see, your gut doesn't sit on bone, it sits on muscles. And normally those muscles don't get exercised at all, but they're very, very helpful in helping you maintain your prostate and your bladder and other organs associated with that, your urinary area in your body, your kidneys. So here's an exercise. You tighten and hold your pelvic floor muscles for 5 seconds, count 1, then count to 2,000, 1,000, 2,000, etc. So how do you do that? Quite simply. Stand up. No one will know that you're doing this. Just stand up. Imagine that you want to pee and you're going to hold it back by tightening, yes, the front of your anatomy, of your, you know what I mean, genitalia, okay? You want to go to the bathroom and you're going to practice that. No one knows that you're doing it. And then you switch around to the back of your body and pretend that you want to go and do a big job in the bathroom. So you're going to tighten your rectum. And those are the 2 ways that you can exercise your pelvic floor muscles. And of course, the main one is squatting. Do squats, like weightlifters doing squatting. You can actually do that. And that's how those muscles that hold up your gut, that's how they get exercised. Use it or lose it. Okay. Suppose you're diagnosed with a lump on your prostate. When they do the digital rectal examination, they find a lump on your prostate gland. It doesn't mean it's cancerous, it's just a tumor. So you then have to go away and have a biopsy performed, okay? And there are two main types. You have an ordinary biopsy, where they go with needles and pick at random all over your prostate gland. That has two negative effects. One is that they may miss cancer if the gland is cancerous. And secondly, that reduces your sexual potency quite a lot. But there's another type called an MP-MRI, yes, ultrasound, where they can detect where the cancer is, if there's any. And then instead of having to go picking all around your prostate, they can target the cancer cells, and that helps you maintain a large degree of your sexual potency, all right? Now, when they do this, there are 5 different grades of prostate cancer. When they do this, they're looking for the 2 most prolific types, okay? So the most prolific is called your primary, and your second most prolific is called your secondary, all right? And this is known as the Gleason grade. What they then do is add the 2 grades together and give you a Gleason score, right? So if you get a Gleason score of 2 to 4, that cancer is very low aggression cancer. If it's 5 to 6, it's mildly aggressive. If it is 7, it's moderately aggressive. 8 to 10, it is highly aggressive. Remember, we spoke about this as far as African and highly melanated men are concerned, okay? Prostate cancer has a tendency to become very aggressive. That's why it's imperative that you go and get treated or get tested very early. Right. I'm going to go through this very quickly again because I'm going to give you a little test. I'm not going to be able to test you on it, but I will give you the answer if you get it, when I get there. So 1 to 5 grade, the most prolific type is given 5. The second most prolific type, lower down, okay? That's your grade. Then they add the 2 grades together to give you a score. 2 to 4, very low aggression. 5 to 6, mildly aggressive. 7, moderately aggressive. 8 to 10, highly aggressive. Now, I want you to answer a quick question. Which of these 2 men has the greater problem? This is just to ensure that you understand what was just said in the previous slide. So here's Tony. He has a primary grade of 4 and a secondary grade of 2, which gives him a Gleason score of 6, 4 plus 2. Trevor, on the other hand, primary grade is 2, secondary grade is 4, Gleason score of 6. So the question is, which of these 2 men has the greater problem? All right, perhaps you can tell me the answer when we come to question time. Okay, let's move on. If you're diagnosed with prostate cancer, then there are 3 things. Watchful waiting, sorry, not 3, but several things. Watchful waiting, hormone treatment, radiotherapy, brachytherapy, chemotherapy, and radical prostatectomy. This is dependent on what you saw earlier, the Gleason score, okay? If you have a high Gleason score, they may say, right, we're going straight for a radical prostatectomy where they remove your prostate gland. Nowadays, they use keyhole surgery, and it still helps men maintain a degree of sexual potency. Okay? African and Afro-Caribbean men and Afro-American men who would have qualified for watchful waiting, in other words, they have low Gleason score, were significantly more likely than whites to have a higher grade cancer that was not detected by standard tests and biopsies. So if you go to your hospital and they say, okay, we've tested your prostate and your Gleason score is 6, then you've got to assume in your mind that your Gleason score is 7 higher. The reason for that, and this came from the #1 hospital in America, Johns Hopkins Hospital, and it was published in 2013. Okay, the reason for that is all of these equipment that they use, they test white mice and white rabbits and white everything. They never test them on melanated animals. No black mice, no black rats, no black rabbits. Always white. Okay, so now this is the Johns Hopkins Hospital. It's came out in 2013 and said, if you are given figures as a result of your biopsy, then you should add on 1 to it. Here's a report from Clinical Cancer Research. Afro-American men who suffered from aggressive prostate cancer were very low in vitamin D. Always make sure that if you're not in the sun, which bare your arms and legs so that you're getting the vitamin D that way. If you have to buy it as a supplement, always make sure it is D3. Okay? If it is anything other than D3, it is synthetic and your body does not absorb it. You're just wasting your money. And sometimes people will go and buy cereal and other foods like that, and it will say on the box, contains vitamin D. And they think that they're taking in vitamin D, when in actual fact, it is something synthetic, which is foreign to your body and not absorbed. Ensure it is D3 all the time. I said I would come back to this one. Pimento, also known as Jamaican allspice, caused a 55% reduction in prostate tumor growth and also caused cancer cells to self-destruct. Remember that? Apoptosis. And this was from the University of Miami researchers in 2014. Latest information, 2016. The connection among hormones, sex drive, and prostate cancer is complicated and could change depending on age. The sex lives of 840 men were studied by researchers at Nottingham University in the United Kingdom. Findings showed that men who had more sex in their 20s and 30s had a higher incidence of prostate cancer. Why do you think that is? I think I'm going to leave it to when we have question times for someone to give me the answer. Okay, I'm going to leave that one for the answer in question times. Okay. That's me, again, that's my website. This is where I am Sunday mornings at 10 o'clock, and that's repeated on Wednesdays, and then on Tuesdays at 9, where I was last night from 9 to 11, lwrradio.com. So let's summarize. Have an MOT every year. And what they do with the MOT, they take 2 vials of blood and they check your organs and everything else. And here in the UK, you have to ask them for the prostate PSA test. Okay? They don't do it as a matter of routine. You have to remind them. And even also with the vitamin D check, which takes a little bit longer for the results to come back. Okay, so remember, if you go to your surgery for your MOT, remind them about the prostate PSA blood test. Reduce your consumption of dairy products, largely, okay? Take a vitamin D3 supplement. Do not ignore symptoms. Eat more green vegetables. You know, sun food, yes, raw food. Add zinc lycopene, selenium to your diet. And I'm going to state the obvious, discuss it with your wife or partner. Okay, that brings us to the end of the presentation.
Thank you very much, Vasco.
You're welcome.
I'd like to once again, this has been a presentation on behalf of the community health researchers, and they are responsible for the Prostate Health We Care Call to Action Roadshow that will be running between the 1st of February to the 30th of March in Haringey, North London. That's within the areas of Bruce Grove, Lordship Lane, Mulberry Junction, Northumberland Park, Selby Road, Seven Sisters Road, Tottenham High Road, Turnpike Lane, West Green Road, White Hart Lane, Wood Green High Road, and the nearby areas. The Community Health Researchers is a partnership of organisations supported by North Central London Integrated Care System. The partnership is led by Bridge Renewal Trust, which includes Sewn Together, Rise Project, Black Arts Production, and Haringey Basketball. The initiative is facilitated by MCW Connectivity. It's a great chance to get a health check, nutrition, mental well-being, employability, and housing information, and get involved in the Quality of Life Expectations Survey. Community health researchers will hold both online and face-to-face dialogues to share the knowledge gained from individuals and families who have had first-hand experience with the support of clinicians and advocates with the cultural understanding and awareness. These dialogues will take place in familiar settings such as businesses, community centres, places of worship, and radio stations. Thank you very much.